So let's look at some clinical examples of ST elevation. And here on the rhythm strip, which is looking at lead 2, it certainly looks like there's something abnormal. And we look down, and here we see on leads 2 and 3, there's clear ST elevation. So looking at lead 2, the isoelectric line is across there. I think we can see that there's elevation between the S and the T. And it's the same, even more pronounced in fact, in lead 3. Clear ST elevation in lead 3. And looking down towards AVF, again on AVF we can see clear, pronounced ST elevation. That this patient has had an ST elevation myocardial infarction. We can see reciprocal changes here. Here there's some depression, maybe it's more obvious on AVL. I think you can see there's depression below the isoelectric line there. These are the expected reciprocal changes. But the key thing to notice, the diagnostic feature here, is we've got clear ST elevation on 2, 3 and AVF. This is an ST elevation myocardial infarction and will need emergency treatment accordingly. And if you've got some experience in reading ECGs, you'll realise that 2, 3 and AVF indicates an inferior myocardial infarction. Well, on this one we notice that there's ST elevation here. There's the baseline, very obvious and pronounced ST elevation on V2 and on V3, on V4 and V5. This is an obvious ST elevation myocardial infarction. It's a STEMI, and these are on the anterior leads. So this is an anterior ST elevation myocardial infarction. Well, in lead 1 we're looking at some reciprocal changes, but we see pronounced elevation in 2 and 3 and again in AVF. And 2, 3 and AVF indicate infarction. But looking across to V4, we also see some elevation in V4, some ST elevation in V5, and some ST elevation in V6. So there's no doubt we've got ST elevation here in quite a few leads, indicating an extensive myocardial infarction. It's an ST elevation myocardial infarction, and it's affecting the inferior leads and the lateral leads. This is an infralateral ST elevation myocardial infarction.